Greetings and welcome to When the Moment Chooses You. I am your host, Coach Charlene, and I'd like to welcome you to this candid, courageous, compassionate conversation that I'm going to have with Dr. Jann Murray-García. In honor of Black Maternal Health Week, I wanted to do something that was extremely meaningful. And so I invite you to lean into this conversation. If you need to pause for a moment, do so, but lean into this conversation because the wisdom that was unfolded by Dr. Jann was phenomenal. So enjoy the episode. Greetings, and welcome to When the Moment Chooses You. I am your host, Coach Charlene, and I am so excited today to have Dr. Jann in the house. Welcome to the show, Dr. Jann.
Thank you. My honor. Thank you so much for having me.
Yes. Yeah, so I just want to tell a little bit, just in case somebody's listening for the first time, the reason why behind starting this podcast. So in 2020, with the murder of George Floyd, it really did something to me internally. And so I went into this, I'm going to say a little darkness for a moment. But then I heard in prayer, what I do in this moment will determine my destiny and dictate my future. And so I knew I had to start speaking up because I had not been speaking up over multiple years of being in an organization. And so I found my voice. And then I began to start sharing my stories of racism and all of the things that I had to fight through as a nurse leader. And so that's kind of where it came from. And so in 2022, I finally got the courage to start a podcast, which I had no clue what I was doing. But it has been such a treat to interview trailblazers and change agents. And I love to have compassionate, courageous conversations because these conversations are totally not easy. And so the way that I met Dr. Jann, first of all, I used you guys in my my master's program. All of the research that you guys did, I was drawing from that because I wanted to deal with the interactions that staff were having with patients that were different races, because I was seeing too many police get called, all of the things that are reactive things. And so I decided to shift my project from nurse leader resilience to culture, humility, and mindfulness practice in the perinatal space. And so it was pretty spectacular. So thank you for all your contributions to culture, humility. I'm sure we'll talk about that in a little bit. So let me tell you guys who she is. So Dr. Jann Murray-García is a pediatrician and health sciences clinical professor at the UC Davis Betty Irene Moore School of Nursing. She co-founded with Dr. Melanie Tervalon the internationally recognized concept of culture humility to achieve equity goals in patient care, population health, health professions, education, and system-level change. Murray-García has developed multi-day experiences, including the overnight interprofessional Central Valley road trip down Highway 99, the 4-week Summer Institute on Race and Health for medical students, and the 3-day Anti-Racism and Culture Humility, or ARC, training program for clinical nurse leaders, School of Nursing, and School of Medical Medicine faculty, health system administrators, and health profession students. Dr. Murray, I want to make sure I'm saying that right. Murray? Okay.
Murray.
Okay, Murray. Dr. Murray-García received her bachelor's in human biology with honors and with distinction from Stanford University, her MD from UCSF, and completed pediatric residency training at Oakland Children's Hospital, followed by an MPH from UC Berkeley. With Melanie Tervalon, she co-founded and is writing a textbook on the concept of culture humility, which they distinguish from cultural competence. She is widely published in the health sciences literature. Her greatest achievements, however, is her marriage in 1992 to her boyfriend of 31 years, Dr. Jorge Garcia, and her children, Canela, Gabriel, Ian, and granddaughter, Sarah, and grandson on the way. Welcome
he's
again. He's here. Okay, that's right. So, that's another destiny moment right there. I got to pause right there.
Right.
So, Dr. Jann, about, I don't know, it might have been, I can't remember how many years ago it was, 2 years ago. So I was looking around to do some type of educational something for us because I just felt like, man, we need to get this culture of humility in here. I mean, we all know what to do, but we're not doing what we know to do. And so
Mhm.
it's like Googling you, and I start just looking you up. And then I think I reached out to you, if I'm not mistaken,
Yeah.
to ask if you do an event. And then at the same time, you were getting ready to have your first grandbaby.
Yeah. My daughter was in active labor at your hospital. And it was during COVID, so I could not be by her side for her first child. And that was so important for me for a number of reasons, not the least of which I study implicit bias and racism in medical practice, clinical care. And it's not about folks intending to give people the short end of the stick or cut corners. It's just what, as you say, you just have lived and seen it, even from the so-called nicest people. And I really needed to be there, but I couldn't. And your request came through that same day, I believe. And I said, yes, whatever you want me to do, I'll do it for the rest of my life. And could you check on my baby girl? And you did.
Yes.
And you did.
Yeah. Yeah.
And
It was.
the baby ended up in the NICU for a little bit, and you saw my son-in-law there, and that
Yes.
was just, I can't thank you enough to know
Mm.
somebody was there for them.
Oh yeah, I was really deeply honored. I mean, because I mean, really, I went into this profession really to just kind of go beyond the person to the soul of the person, because it's a very scary time,
Mm, mm,
especially with the statistics that are going on in
mm,
our United States of America. So,
mm.
I wanted you to tell us a little bit more about yourself, if you don't mind. You have done so much. Can you tell us a little bit more? And then for this week, we know that it's Black Maternal Health Week,
Mhm.
starting April 11th through the 17th. So we're going to kind of unpack some
Oh, that's
statistics
that's great.
and also her powerful wisdom that she's been doing and the work that she's been doing. So let's hear from you, Dr. Jann.
Sure. I am a pediatrician. That was an easy choice to make. I'm from a family of educators. Um, and I have activism on both sides of my family generations back. So I always knew, and I identify as a pediatrician, but in my heart, I'm a community activist. And partly through the mentorship of Melanie Tervalon, with whom I wrote the seminal article on cultural humility, um, I was so fortunate to learn what I don't see a lot of people doing, and that's community organizing in the institutional space. It's not that you have the right answer or the moral answer or the one that should be obvious to everybody. Um, there, you've got to take the long view of doing the same kind of nonviolent social change strategies as Melanie learned when she moved from back east to Oakland in the early 70s. Um, uh, you've got to use those same tactics, and it's exhausting, relationship rich. Again, it's not anything about calling people out and destroying relationships. It's a lot about, as you say, seeing beyond the person to the soul of that person, whether that's a colleague or a learner or someone who's participating in one of my trainings. So all that fits with who I am and who I've been. I when I finished about 10, oh gosh, I can't how however many years of practice I did and had my girl, I had a hard time thinking about childcare. My husband and I were still in training, but somehow we made it work again because I study racism and child development. I was just so neurotically worried about the messages she would get as a Black young girl, as a Mexican American mixed race Black child. And so I built a consulting career from home, did pediatrics for a while on the weekends, but eventually dedicated myself to kind of systems level thinking, and how do I center social justice uh, as a resource for improving population health. So we're kind of stuck in fixing individuals or fixing families or fixing communities, giving them what they don't have. And it's just like, well, no, this is a much broader issue of how we've done race in America for the last 400 years. And what does that look like? And it's just such a privilege to be here to try and illustrate just one clinical entity, and how we've done race for 400 years still shows up in our clinical work, in our teaching the next generations of health professionals, and in our research and policy. So that's a little bit about me. I don't know if you had more specific questions.
No, that's
Yeah.
beautiful. I did see one thing online. Just I wanted to see if you can talk a little bit about it. But
Mhm.
you had worked with some students at UC Davis from the community, from the classroom to the community.
From the it's they were actually Davis High students, so
Okay,
adolescents, and I live in Davis, California, and the movie, which is free on YouTube, is called "From the Community to the Classroom," and it's called that because we were in the early 2000s experiencing an incredible number of hate incidents and hate crimes in this idyllic progressive college community. And it turned out that many of them were perpetrated by the community's own kids, as much as people tried to deny that was happening. And so, one of the solutions that came from that was to work with young people, training them to do research, and to help us understand as adults how they were learning and doing race. That So much so in ways that were perplexing to adults, that we were having several of them thinking that hate crimes, um, just unspeakable things that were happening. Sure, that's the tip of the iceberg, but that must mean that there are some messages being implicitly taught in our liberal progressive community. And so that's that. I did that work for about a decade, including writing a column for our local newspaper on parenting and race and social justice issues, to kind of point out, with data, child development theory, where we could intervene and where we weren't intervening in the lives of our children, as we all want the best for our children. We can't have that unless everybody's child has the best.
yes. Yeah, you know what I found fascinating? I did watch the whole thing, and what really was inspirational for me is how you engaged these kids into actually dialogue. I mean, they had some really hard conversations, and at the beginning, it was tough for them to have those cultural conversations about, or really hear another person's story. And then by the end, they had such solidarity. I was so excited. I was ready to go out and do a movement after I
Yeah,
watched it.
right, right,
But
right.
it was just amazing. So thank you for sharing on that. So the reason why I wanted to also bring Dr. Dan is because of this week that's coming up. I mean, we shouldn't have to have a week that's recognized for Black maternal health, but we are. And she's already talked about the 400 years of what we've been dealing with. So I was just going to share some real brief statistics on some of the things that are going on, just in case there's some listeners that don't know about it. In 2021, the maternal mortality rate for non Hispanic Black or subsequently Black women was 69.9 deaths per 100,000 live births, which is 2.6 times the rate for non Hispanics, subsequently white women. So 26.6 is the white women's rate. But that was massive, because in 2021 we had a total of 1,205 women die of maternal causes in the United States compared to 861 in 2020. This particular quote came from, let's see, where did I get this one? Oh, the Government Accountability Office. But what we saw was that from 2018 to 2021, we have gotten worse,
Mm,
absolutely worse. So, and in particular, the divide for Black women has increased. And
mm.
so they were saying that there was, the Black women was 69.9 compared to 26.6 for white women, which is just not okay. So, Dr. Jann, help me out with that. What do you think about those statistics?
Yeah, it's tragic, right? Because that having a child, as with, and now having a second generation of being part of that, is one of the most anticipated, hopeful beginnings in our lives, times of happiness. And um, oftentimes these are healthy women who
Yes.
are going in to do something natural, and they don't make it home. And I forget who it was who said, the things I've watched, Monica McLemore, Joy Greer
Mm-hmm.
Perry, Karen Foster, um, said we can't just look at 1,000 women. You got to look at 1,000 families, often
Yes.
siblings of birthed or babies that didn't make it, that then aren't going to have their mom come home. Um, it's tragic, and much like the hate crimes in Davis, it's also, I think, a tip of an iceberg that tells you that things aren't right with our healthcare system systematically. And what I think about this is that we measure this kind of racial difference in so many different clinical areas, whether it's kidney care or pain management, um, who gets what procedures when they hit the emergency room with chest pain. I know it's hard to imagine, um, but the quality of care people get, um, is a racial phenomenon in part. We can measure differences in the level of care people get, consistent, again, with 400 years of a racial hierarchy that has white folks at the top, Native and and Black folks towards the bottom, and then other groups, depending on the clinical entity, somewhere in the middle. Um, and there should be no reason why your race should predict the quality of care that you get. Um, and then even when you control for what people come in for. So if you tell me, oh, aren't Black people sick, or aren't Native, even when you control for whether they have insurance, education, high income, what they get from the healthcare system is different. And I will say this, that people look at infant mortality rates and maternal mortality internationally because it captures a lot of things: what happens before pregnancy, what happens during pregnancy, the quality of healthcare, the access to healthcare, the political redistribution of wealth, the differences in it. It captures the well-being of a nation in a way that a lot of other statistics don't.
Yeah, absolutely. I was also looking at some C-section data as well. It says during 2020, 2022, in the US, C-section delivery rates were highest for Black infants, 36.6%, followed by Asian Pacific Islanders, 33%, Hispanics, 31.6%, and whites, 30.9%, and American Indian Alaska, 29.1%. So, I mean, I'm just curious. I mean, I kind of know what's going on there a little bit. I think it's we're not being listened to a lot of times. I've had patients that say I really didn't want a C-section, but I felt like I had to do it because the provider said I needed to have one and I wanted my baby to be safe. And so, any comments on the C-section rates in particular?
Yeah, I don't know what date. Do you have the dates on those?
This was 2020, 2022.
2020, 2022. So, it, interestingly, in 2021, there was an equation that got changed for women who've had a C-section and who want to try and labor and have their next child naturally. It let's see, about 15 years had gone on, the use of this calculation of risk that
Mm.
put Black women and Latinx women at higher risk systematically. So you got negative points in this equation. And they, after Mr. Floyd, and even before that, but intensified with Mr. Floyd's public murder, people started pressing, wait, why are we using race? Why are we using race to determine somebody's reproductive biologic capacity to have a safe birth, as opposed to quality of hospital, whether folks feel like they were listened to, all these other things? And so they changed that algorithm just to take out um, Black race and Latino ethnicity. So that's one reason. The other is very well documented that women in general don't feel listened to by the healthcare system. But add on that Black race and Black women, there's just a lot of documentation about that power differential between the healthcare team and the woman and how it gets played out. Um, we don't have, and folks aren't going to say we don't have time to wait. I don't want to wait. Let's just go ahead and do it. I like surgery, whatever it is. It's nuanced and hard to measure, but we sure do measure that Black women are more likely to get C-sections than other women, and and C-sections have a mortality rate somewhere between 4 and 10 times as high as a vaginal delivery. So automatically, when Black women are getting higher C-section rates, they're dying at higher rates just from that one line of birthing
Yeah.
alone. I will say this, it's not, if I could go into our first topic, I wanted to say, again, this isn't about how much education somebody has. This isn't about the low income Black woman always. It's worse to be poor and Black, but that's not the whole story. It's not about how much education or even insurance people have. There's something about being Black in America, and those of us like me who've been followed in a store, who nonetheless make money, well educated, all those years, we're still going to be followed because the way we do race in America, um, I forget who said that. All the class stuff and education stuff just gets collapsed into being a Black woman. And what I know about being a Black woman, if I'm a provider, no one's probably taught me anything more than what you've seen on television or what you heard about, or more importantly, what you didn't hear about and are drawing from. So I wanted to say that because people like Serena Williams, one of my um, favorite athletes, had to actually kind of vigorously insist on being listened to about what was going on in her body. Shalon Irving was a Black woman, 36 years old, who believe she was in Atlanta, 2 PhDs, worked for the CDC and the Public Health Service. Went back after her, what was a high risk pregnancy, but everything came out great. But in those 3 weeks after, she went back several times, had people come over the house. She kept telling them something's wrong. And to hear her mother tell it, who was with her on every visit, they're like, give it time. You just had a baby. And then On the day of one of these visits, she collapsed in front of her mother and never regained consciousness. The hospital said they didn't need to do an autopsy. The family paid for an autopsy, and it was damage from sustained high blood pressure postpartum
Mm.
that they should have picked up. She was swelling. She was having headaches. Um, I'm not. I can only guess at why, like with Serena Williams, who'd had a blood clot before, had a pulmonary embolus, blood clot in her lung, was a Black woman, was postpartum. All of these things put you at extremely high risk for subsequent pulmonary embolus. How is it that we looked past all that objective data and didn't listen to her
Right.
when
Right.
she told them, I'm having a pulmonary embolus? And indeed she was.
Yeah.
These are not poor women. These are not uneducated women. But they teach us a lot about the healthcare system and how it lets Black women down.
Yeah, I think that's so powerful. You said something earlier, and I found a quote by Dr. Barfield. It says, a maternal death is more than just a number or
Mm,
part of a count. It's a tragedy that leaves a hole in a family. And so when you said that, and I think I found a picture of, it was a little girl, and she had drawn this big chalk figure, and she was curled up in a little ball inside the chalk figure.
mm,
And it just really hit me that, oh my God, that was her mom that she drew. And she was like curled up, missing that hole in the family. It's such a traumatic thing. And when you, as a clinician, like for me, I'm passionate about it because I've had to go in and see somebody put on their birth plan,
mm,
I just want to live, period,
mm.
as a Black woman. I mean, that is, it just should not be that way, but it is. We find ourselves in this place, and it's so traumatizing. Quite honestly, I have to be honest.
For you.
Even as I was getting prepared, Dr. Jann, I was like triggered in so many ways because it happened to me when I delivered at a system, and they didn't listen to me. I was trying to tell them that, hey, I'm in pain. I'm in pain. I need some help. I have that. I want an epidural. I know I wanted to do all that, but they did not listen. I mean, I was in agony. My husband finally had to say, listen, I need you guys to do something about this. But it was so degrading. You felt so helpless and hopeless that you don't really know what else to do because you're kind of at the mercy of those
You are.
that
You
you're
are.
being cared for. So yeah,
You
I'm so glad for the work that you're doing, because that's why I thought about the cultural humility aspect, because you can learn about cultural competence day and night. Doesn't mean that you're going to actually be humble enough to allow the patient to teach you and
There
let
you
them
go.
be the expert. So I absolutely love the work you're doing. I heard you say that history shapes our professional roles and conduct. What did you mean by that?
Well, and I would say I just want to acknowledge to just that this is triggering for you, and yet you are serving us by hosting this conversation, and appreciate you doing that. I would just tell one more story. You can find it online. Kira Johnson's story.
Yes.
Uh, a little bit advanced in age, but still a marathon runner, a race car driver. This is not anybody's low income, you know, Black woman, the kind of euphemistic stereotype we had. Not clear why she was having a C section, except that she had had one before. I don't want to accuse anybody of anything, but it sounded like it was a smooth pregnancy. And anyway, during the course of the C-section, the obstetrician nicked her bladder, and which it happens. And the family saw the blood in the urine catheter for over 12 hours before someone did anything about it. In fact, at one point at Cedars-Sinai, um, the healthcare team told her husband that his wife was not their priority. Finally, when the floor fell out, essentially, they took her to surgery and she died within 10 minutes with 2/3 of her entire blood volume in her abdomen. And it reminded me of what you're saying, Charlene, because of what your husband had to do. Because this man, Charles Johnson, wrote later that he really wanted to insist. But his wife, and he knew too, knew that they were at risk for him as a black man having security called on him, the police, or just having um, been thrown out of the hospital, and then she's alone. And he says he regrets that decision every day. So
Yeah.
again, what's that history of there's the angry black woman, but then there's a dangerous angry black man that we have to negotiate and figure out when you're going to deploy, take the risk, you're going to deploy a higher level of insisting on the best for your family member at the risk of activating these historical stereotypes. So when I talk about how history follows us into the clinic room, and just before we move on, cultural humility is different than how cultural competence came to us as physicians and medical students. It was kind of like a mastery of the other, more of like you can interact cross culturally, like as technically as you can read an X-ray or start an IV, and it's an ahistorical um, uh, approach if you leave it at that. And I'm not going to criticize cultural humility, part cultural competence, in part because a Native American brother, Terry Cross, founded the concept in a much more full way than it came to us, with a relational worldview and systems level thinking that was there before kind of the more narrow cultural competence. So it's about self-reflection and self-critique, um, redressing the power imbalances, as you say, becoming the student of the patient. Can you do that?
Yeah.
Can you, do you have the identity strength to say, I might not know, or I'm about to make a mistake? And as ugly as that seems for me, I had to cut my losses and give this person in front of me the best that I can. And then the third one is honoring the expertise, mutually beneficial and non-paternalistic relationships within the community, honoring the expertise that's in the community. And then the fourth one is a system level um, application of those three tenets. So institutional self-reflection, etc. And the one that I've most recently dealt with as we're writing the book is this notion of historically we are scripted not to listen to black women. If I can say that again, historically we are internally scripted to dismiss the expertise of black women, to not see it as anything we need to pay attention to.
Mm.
And this is a lesson of omission as much as it is commission. Probably nobody told you that, but unless people were interrupting these historical scripts that started back in the 1600s, they're still living with us. They're still active and very powerful. And I found the work of Patricia Hill Collins, who's a sociologist at Maryland, and a woman who wrote Sister Citizen, Melissa, Melissa, Melissa Harris Perry. I found their work to be powerful, and there's a bunch of people too in the nursing arena, in education, etc., therapy, that look at these four, what Collins calls controlling images. You can think of them as stereotypes, but they started hundreds of years ago to uphold a system that profited from the degradation of black women. So 5 scripts: the Jezebel, the Sapphire or Angry Black Woman, the Mamy, the Welfare Queen, and then the Strong Black Women. I'll try to go through them pretty quickly. But the Jezebel is this idea that Black women are hypersexual, hyperfertile. They have an insatiable sexual desire. They lack self restraint. So, those of us who are morally superior need to control their behavior and supervise their behavior. I'm being facetious in that.
Mm-hmm.
And you can see how that lets you off the hook historically if you're the slave owner who's serially raping Black women or impregnating them with other Black men to enrich your wealth. If you're taking away their children, it's a very useful construct, right?
Yeah.
To say, oh, they need us, they cannot help us, at the same time that you've justified the sexual violence that you've done as nothing that bothers Black women very much. Again,
Right.
sarcastically put. And the way I see that, the way we see that, and this is what I've done, and what you've read of mine is just one chapter in the whole book, is how does that show up today in our clinic? And what we see is, for instance, Black women are more likely to get urine tox screens than other women. And
Yes.
even though the American College of Obstetrics and Gynecology says there should be universal screening, urine tox screens, Black women are still much more likely to get those urine tox screens than other women. Almost like we feel like we need to supervise or monitor the behavior of Black women more than other women. There's the idea that this is just one clinical example. Used to be thought that Black women didn't get endometriosis or didn't get endometriosis at the same rate as white women, that they were likely, Black women were more likely to have something called PID, or pelvic inflammatory disease. Endometriosis is where uterine tissue is found outside of the uterus, can be very painful, cause horrible periods, but the only way to definitively diagnose that is for someone to look at the abdomen, and so you have to believe that patient's pain enough, and we didn't, and we often don't believe. We often take the pain of other women more seriously than that of Black women. And a lot of folks, doctors practicing today, were taught, hey, if it's abdominal pain in a Black woman, it's probably PID, which is from sexually transmitted diseases that then don't get cured but invade the fallopian tubes and the ovaries in a chronic manner. Does that make sense? So you've
Yes.
been taught to see the Black woman as closer to the sexual beast, and it
Yes.
can influence your diagnosis. Treatment of sexual assault victims, also, a lot of Black women don't even report their rape, because it wasn't until the end of slavery that a Black woman legally could be raped. There was not a definition, and that has carried forth in not just medicine, but in law and the criminal justice system, where Black women are less likely to have their rape completely investigated, brought to court, um, um, and get the kind of justice that they deserve. Again, this is a phenomenon of women,
Mm-hmm.
but when you overlay the intersection of Black women, it becomes more intense. There's the adultification of Black girls that we talk about, where we systematically hold Black girls of the same age responsible for behavior of an older girl that they're not capable of.
Right.
we see them even as girls as sexual beings. So the story, one of the stories, was from Newsweek, was a 12-year-old. I forget where she was from, and outside doing her TikTok videos, was dragged to the side of the house and raped. Didn't tell her mom, was horrified, didn't go outside. Mom had to take her to the ER weeks later when she started vomiting.
Mm.
Didn't know what was going on with her. And the nurse walked in the room after some blood tests and urine tests and says to her, "What have you been doing?" Not what happened to you.
Right.
You must have been so scared. But what I just, so that's one way that that history follows us into the clinic exam room. The sapphire, the angry black woman, comes from Amos and Andy, and the character Sapphire, black woman who's always criticizing her black man, and getting angry and sassy all the time. And I like to say that again, 400 years where the dissent of black women against oppression and inequality is pathological, right? You don't
Yeah.
get to say, you don't get to be angry. You don't get to cry like a lot of women get to cry when they're misunderstood,
Hmm.
right?
Yes.
Um, and we know from good data that women supervisors in organizations just get hit with this. Oh, she was doing her job as a supervisor. She's bullying me. She's aggressive. She's angry. Um, we know that black families in hospitals are twice as likely to have the police called on them than other families. And it's a toss up about, again, do you aggressively insist on your rights and your needs being fulfilled, or do you step back and not have your needs fulfilled? Such a catch 22, right?
Yeah, absolutely. Just real quick, when you were talking about the let's see, the first one, which was
The
the
Jezebel.
Jezebel. Yeah,
Mm-hmm.
I mean, I totally went back to, like, even in nursing school, I remember just shadowing somewhere one, and it was African American. She came in, and this was her sixth baby by a
Mm-hmm.
different father. And
Mm-hmm.
oh my God, the stuff that they said about this woman was so
Mm-hmm.
horrible. But it just makes me think about a lot of the words that we use, even because of the different. I think you talked about the historical scripts that people, if someone comes in and they're on their 10th kid, they're judged before they even get there. You know what I'm saying? So it's really, I really like what you're talking about with these historical scripts, because, like, even as clinicians, all of us, like even me myself as a black woman, I have to
Mm-hmm.
check my scripts all the time
Mm-hmm.
because I've been
Yeah.
programmed,
Yes.
right? So I
Yeah.
have to, when I see, like, I'm going to share a story with you. There was a young couple, and they weren't together, but they were having a baby, and so there was some arguing going on in the room. And so they text me and they're like, "Hey, I'm getting ready to call security." I was like, "Can you just, like, talk to them and see what's going on first?" And so they did. She did. She was like, "Okay, I'll try." And then she tried. She said, "No, I can't. I'm going to call security because he needs to get out of here because he's messing with my patient." And so anyway, I came out, pulled the young man out, and as I'm telling you, Dr. Jann, as soon as I saw him, I judged immediately. I had to grab my brain. I
Mm-hmm.
had to be self aware enough that, oh, look, you just thought a wrong thought.
Mm-hmm.
Now I want you to breathe into this deeper, lean into him. And so I start leaning into him, like, as a humanity. And I start saying in my head, like, oh my God, he's like young enough to be my son. And
Mm-hmm.
then I just start talking to him like a person, and he just broke down and he started crying. He said, "Well, she's not going to name the baby after me. That's why I'm upset." That's
Mm-hmm.
the only reason that he was upset. But now they're ready to, like, call the police and all this other stuff. And this little guy was just hurting. And
Mhm.
so to have that, but I had to check myself as much
Sure.
as I know. And that's why it's like a daily walk. So when I felt myself doing that, that self critique, I think you said the self critique really helped me out tremendously, because when I felt that, then I was able to reinforce love in that situation, because that could have
Who
been
you
my son.
want it to be, who you
Yeah.
want it to be. And this is the thing, it's not a cognitive process. it's
Yeah.
it's it's being in touch deep in your identity with who you are, and all the scripts that we didn't ask to be taught but are there by
Yes.
definition. To be an American is to be scripted for inequality when it comes to race, when it comes
Wow.
to gender, when it comes to sexual orientation, when it comes to privately versus publicly or uninsured, right?
Yeah.
Um, and I love what you said about one of the evidence-based ways we know to interrupt implicit bias is kind of what you were describing, the mindfulness in the moment. There's a mindfulness practice over time that has been shown to be associated with less implicit bias. But then there's this mindfulness in the moment when, before you act on your script, you sense it, you hear it, and you interrupt it, right?
Yes.
But sometimes the only way you know you're having it is because your body is doing stuff, right? Your heart is racing, you have a fight or flight,
Yeah.
you're irritated, and this, heaven forbid, you should be hungry, tired, too much to do on top of it. It gets magnified. But recognizing that, Charlene, takes a level of humility to say, ooh, that's not who I want to be. Or,
Yes.
ooh, like I've done, wait a minute, I've given birth to a black man. My,
Right.
my brothers are, where did that thought come from? And I'm not sure all of us have the courage and the ego strength to do that. Some of us just get locked in shame and guilt. It's just like, look, this precedes you by 400 years. Let it go so you can be the person you want to be in that moment for that patient. Um,
Yes.
it takes that cognitive discipline and practice. And honestly, sometimes we don't know because we think we're all nice. And my best friend is Boopy Doop, fill in the marginalized community. And sometimes it's only in documenting how your unit has done or how you've done, um, that decreases that inequality. How many C-sections has your hospital done? And then the California Maternal Quality Care Commission is able to give individual obstetricians their C-section rate. So you can't say, it's not me, I treat all
Mhm.
my patients the same. That's the power of data. And then your colleagues can see how they are within a hospital. This has been very shocking to people, the CMQCC, and what they're able to give to people in terms of data. So instead of, I've helped poor people, oh, wait, what? That's my C. You
Yeah.
need correct data, not what your intent is, what the outcome of your
Yes.
behavior is.
Yes. Awesome.
Yeah.
Whew.
Yeah. Do you want to keep going
Yeah,
or?
keep going. That's good. I'm
Okay.
loving it.
Okay. So the Mamy is the next um, kind of stereotype or controlling image that scholars, feminist scholars, talk about, Black feminist scholars. And the Mamy is that kind of rotund Black woman who's always happy, who prioritizes the well-being of white children and white families over their own. Um, they don't ever express anything negative about oppression or injustice. It's how we can say, oh, the slaves are really happy, or I had an auntie, or I had a big mama that raised me, and then that's how you know you're progressive and equitable, because you had this woman in a subordinate, underpaid position who never complained. By the way, because she couldn't, right? And kind of that Aunt Jemima character. In 1923, the United Daughters of the Confederacy wanted to put up this monument in Washington, D.C. by the Lincoln Memorial. And it was called a monument to the faithful colored mammies.
Mm.
And it's this idea, as the other monuments, Confederate monuments were, that establishes a mythology that slavery wasn't that bad. And Black women weren't bothered by the selling of their children or their husbands or their siblings. They weren't bothered by rape. That didn't even you can tell a bunch of stuff from these controlling images. So that, again, the idea that you would be angry in a clinical situation or in a classroom or in a job site really is an affront to that Mamy, that 400 years of silencing Black women, no matter what they had to deal with. Does that make sense?
Yeah, it really does. Yes.
So sometimes you'll ask people in authority a question and they'll take it like you're insulting them, when that's not how we take the questions. I'm thinking in a pediatric sense. It's not how we take the questions of white families. We talk about them being engaged and caring, and they want to be involved. But if a Black family asks more questions, even might doubt based on their research, or heaven forbid they did research, then it becomes this, wow, that's not who I'm used to Black women being in my life. Even though you weren't there during slavery, it's still live. It's still so metaphysical and spiritual for me how this manifests today. Any kind of challenging behavior kind of
Mm.
makes you, may trigger people to think, ooh, that's, and it's often because it's a Black woman that it becomes a racial thing and not with other women.
Yeah. So in that case, I can see that women just shrink and they won't say anything, right? Because they're trying to advocate, but then here's this power struggle. I mean, do they just get silent and they don't say what's really going on with their bodies?
Well, it depends, right? I mean,
Yeah.
we have stories where they said that and they were seen as angry, or
Yes.
people backed off or looked offended or scared or
Yeah.
threatened, right? Um, we've had situations where people do that and it turns out fine.
Right.
Uh, and then we've had situations where people have done nothing or kind of held back, kind of like in Kira Johnson's case. And
Right.
she's gone, and the husband, not an angry Black woman, but she wasn't going to play that either, and she's not here anymore.
Right. Right.
And you do. I just don't know that people understand. I've had people say, well, why didn't you get the police officer's badge, and why didn't, and they have all kind of ways that their racial privilege, that would have been okay. But not only would that endanger my safety if I had the same if I perform the same script, but I'd be doing it 3 and 4 times a week.
Right.
It's exhausting. You have to pick
Yes.
and choose, right?
Yeah.
And I don't know if people see that we like our Black women, especially our older Black women, to be more like mammies than what we would like. We encourage patients to do, which is to self-actualize and to activate and to ask for what you need from the doctor,
Yes.
right? It is
Yes.
a catch-22. The next one is the welfare queen, which was made popular in the 60s by Daniel Patrick Moynihan and others. Even though the face of poverty in newspapers and magazines before the civil rights movement was white, overwhelmingly white. After the Civil Rights Act of 1964 and how the equalization of how social welfare benefits were doled out, which was racially unequal before, then you start seeing in newspapers and magazines that the face of poverty becomes Black.
Mm-hmm.
And you get this welfare queen who, has 5 different addresses and is getting AFD and all that kind of stuff. It's again 400 years old. The idea that they like having babies, they're hyper fertile, hypersexual, irresponsible, um, uh, angry at their husbands, inattentive to their kids. Welfare queens are actually a danger to society because they're raising these uneducated, wild children who are closer to animals. So that is a very complicated kind of a mixture of the Jezebel and the sapphire, right? And
Yeah.
a contradiction we're not comfortable with of the Mamy. Um, but things how it how it manifests clinically is how Black mothers can be treated, assumed to be on welfare or Medi-Cal when they have really good private insurance. No one should be dehumanized in any way, whether you have public insurance or private insurance. But that's come up a number of times. I've actually done that myself, assumed that a Black woman had Medi-Cal, was a beneficiary of the government in that way. Again, the talk screens, kind of this idea that Black women are unfit mothers. So we see in the in the foster care system, Black children are in foster care more. They're in there longer. They're less likely to get supportive services, and more likely to have their parental rights terminated. So not just in healthcare per se. And we see this, really poignantly in the opioid crisis. You remember in the
Mm-hmm.
crack epidemic,
Yes.
the crack mother and the crack baby were just almost social phenomenon. And that crack addict, it, who would be called a substance abuser now, with a brain disease, was treated as a criminal and a morally abhorrent individual, as opposed to now in the opioid epidemic. We know that folks who suffer from substance abuse disorder have um, brain disease and need to be treated tenderly and compassionately as such. That didn't happen back in the 90s and 80s. Didn't happen. Um, Also, for many of these, you can talk about forced sterilization that went on um, from the time of eugenics in the 1920s, where the idea was we need fewer non-white people to save the earth for white folks, to purify that race, to keep the intermarriage out of the picture. And so tens of thousands of women were sterilized, up to 1 to 4 of Native Americans, 1 to 3 Puerto Ricans on the island. And then lots of folks who were just in the way, right? Who were
Yeah.
practiced. It was justified. It was practice for residents, surgical residents, and others to do. It was so common, the forced sterilization without a woman's knowledge. In the South, it was called the Mississippi appendectomy.
Yes.
And again, that idea that we need to monitor the reproductive behavior. We are, for the sake of society, in control of the reproductive behavior of Black women. I say how many children you're going to have.
Yes.
I have the power to do that. And the last one is a strong Black woman who can withstand anything. Um, you're laughing. I know we're going to have a conversation. And they can historically withstand rape, forced pregnancy, selling away of their children, taking care of other people's children when your children don't have anyone to. We can do anything to Black women. right? They're strong. And on one side, it's a compliment. On the other side, it's killing us in a lot of ways,
Yes.
right? Um, we know that we can measure higher wear and tear, allostatic load on the bodies of Black women. And I think we've really are doing great trying to separate ourselves, distance ourselves from that controlling image. I mean, I have it as part of my identity as a Black woman from my mom, from Rosa Parks, from um, Coretta Scott King. I have it as a positive sense of who I am.
Yes.
The negative side of that is if you just internalize it and perform that script unthinkingly, you are helping to perpetuate a system that depends on that kind of exhaustion
You know
and
what? That's so powerful. It's so powerful. I have to pause right here because, I consider myself a strong Black woman. And so I heard this spoke about a few years ago, and I was like, oh my gosh, because um, if you're not careful, and this is where I had to get that awareness, if you're not careful, because you're the strong Black woman, everybody's piling everything up on you. I found myself stepping up to the plate, stepping up to the plate, stepping up to the plate. And after a while, Dr. Jann, I saw myself losing all of my loaves of my bread. I was empty. I had
mm,
nothing left because I was trying to be all for everybody when nobody really was caring what I was doing. I mean, honestly. And so I took some time off, and then I found this quote that said, "You don't die when your heart stops beating, you die when your heartbeats have no meaning." And
mm,
so it really hit
wow,
me in the gut because here I am making this happen for everybody. And I'm like totally just inside because I'm strong. I don't need any help,
mm,
but no, I'm not okay. In 2020, I was not okay. And I was okay with saying I wasn't okay. And I
mm,
refused to continue to go on the way that I'm going. And so I had to get to that place of strength, though, within myself to say, no, I'm done. I'm saying no more. I'm only doing things that brings meaning and joy into
mm,
my life. But just
mhm,
that script that I hear you talk about is
mhm,
you take it. You just keep taking it until you start feeling physical things happen in your body. Like, okay, I better pause. I want to live, and unfortunately, I had during COVID, right before COVID and right after, I had two sisters that died. One was
mm.
55 and one was
Oh,
44.
oh,
V-
young.
yes, very, very young. And it just plays into it, this strong Black
Sure.
woman that never asks for help, that's doing everything that they can do to take care of everybody, but they never stopped and took care of themselves at all. They didn't follow their dreams. They didn't do anything. They
Mm,
just did for everybody else. And it resulted in, cardiac issues.
mhm.
So yeah, that's so powerful. I'm so glad you brought that up.
Yeah, we could talk about that. Black women are more likely to have stroke, die of stroke early, have their first heart attacks earlier
Yeah.
than say white women. And I think part of this we can measure the cumulative wear and tear on a woman's body by 8 to 12 different things that we measure, not a blood test. But we know that in one study, the most famous study, Black women who were 50 years old had the biologic body of a 60-year-old white woman.
Mm.
And education and income that you attained did not help, did not protect from that, like so many other social determinants of health are. You're protected by how successful you are, you can imagine. In fact, the disparity between successful Black women by income and education is even greater between Black women and white women the more successful you get.
Mm.
So there is that, but then there's how it shows up in the clinic room. So Black women are less likely to be assessed for their postpartum depression. They're less likely to get, they're more likely to have it. They're less likely to get medication for it. Kind of like she's not going to break. And you have to, there's some sociology, history sociology done where people look at Black women as these medical super bodies, we call them. And if
Yes.
you think about all of the experimentation that's been done on Black women that would never be done on white women. So that's what I've got, and it's a lot to think about. It was a hard chapter in this book on cultural humility to write, hopefully for obvious reasons. And I'll have to tell you too, Charlene, it made me think of how I raised my daughter, right?
Mm-hmm.
And then how I roll what my son is seeing, me not stopping, me,
Yes.
it's
Yes,
it's
that's good.
amazing. It's amazing. We saved our nation and have honed a practice that is physically and emotionally destructive in some ways for us. And so for me, the point of making these historical scripts visible is so that we can interrupt them, right?
Yes. Yes.
And there are a lot of the disability community, the uh, the LGBT community. They have their own historical scripts that get lived out in the clinic, but this was the one that was most accessible to me. Um, and if you can't see these scripts, you won't be able to interrupt them, and then the performance results in the same unequal outcomes. And that's kind of, we have to be curious about each other. And in an age where people like Ron DeSantis and others are mandating that we don't teach American history, all that we know about it's going to kill us not to. It's going to kill us literally, and we're not going to be who we could be for each other if we don't know each other's history and how that relative connection to one another shows up in how we do America every day, to our detriment sometimes, to the systematic detriment of some peoples.
Yeah. So, Dr. Jan, given how entrenched these historical scripts are in society and in ourselves, do you see any hope for decreasing the Black maternal mortality rate?
I do. I do. I'm surprised it hasn't come down already with the level of attention that it's gotten. I heard a story on NPR of a white OBGYN physician who heard a nurse leader, educator give a grand rounds on maternal mortality in the Black community. And she shared the story of Serena Williams. And this white woman said she went back to the office and was thinking about, anyway, somewhere in the next week or two, she saw a Black woman who came in, by the way, kind of minimizing her calf pain, but she had it. And this white physician thought about this lecture and said, you know what? In the past, I wouldn't be so impressed, but let me. And the woman had a blood clot that could have killed her or killed her child. And she said, for some of us, when we know better, we do better. That we know enough to know that's not enough to
Yeah.
solve all the problems. But for those of us who are looking for ways to be better in the statistics that we produce as a collective healthcare workforce, sometimes when you know better, you do better. And if you know there's a script out there, even if you can pause for a second and go through your mind, even if you can hone the ability to hear the script as you did and reacting to that, to the young black man, then you can interrupt it before you perform that. So I think we need, you can't, it's not a, if it were a technical problem with a technical solution, I think we would have solved it.
Yeah.
I have to say, even as I'm saying I have hope, that these issues go to the core of our identities, collective and individual. So if we're not going to do that work, then no, I think we'll just keep moving on, but and getting the same unequal outcomes. But the state of California is requiring implicit bias training for maternal care providers, which is good. and high quality implicit bias training has been shown to be successful, despite what folks said. Um, we're starting to use doulas, Black doula.
Yes.
I mean, that's just a slam dunk. That's so easily, demonstrably effective. Um, and we can put people to work, right? And we save so much money and not having sick women and sick neonates and missing from our community who could be generating for all of us. I think the model of the California Maternal Quality Care Commission is really fascinating. This is an entity I talked about that will get hospitals their outcomes data within 8 weeks instead of a year from now, a year and a half from
Right.
now. And so it's you have to subscribe to it. And if you go on CMQCC, you can look up whether the hospital you're delivering in subscribes to that data enterprise, and whether individual obstetricians and hospitals are getting that data back so they can fix the issues real time.
Yes.
Because part of it is we all just think we're so nice, and my grandpa was on the bridge with Martin Luther King, so therefore I couldn't be racist, whatever. We just, the idea of implicit bias is that it operates outside of your conscious awareness. So you're not going to know when you get it wrong. The only way to know you get it wrong is to have someone who loves you tell you, have someone who doesn't know you tell you, or to look at your data over time. But don't tell me you don't do that if you haven't done the data analysis somehow, and you're not doing that. That's another reason I think women have to continue, if we can, be very explicit about our experiences. Um, when the forms come back and their satisfaction forms, if you didn't have a good experience, don't put a 5 down. If you had a horrible experience, put it 2. And I'm telling you, hospitals get paid for those ratings, and they get compared to one another with those ratings. It's a really great way. It'll be anonymous. If you want to talk to someone, you can say, sure, call me about what happened. You can real time call patient relations in a hospital. If something's going on and you're not comfortable with it, you can call the chief nursing, the nurse manager on call. If you just want to say halt to something a physician or a nurse or anybody else is doing. Um, Folks have heard this now, right? So you're not a lone echo. You're not the only one. No one can say, hey, no one's ever said that about our unit. We can't do that now because of
Right.
the movement that's been so successful. So people, I have this sense, will listen, um, especially in big metropolitan cities. Well, they have to listen because they have to compete with the other health systems for your dollar. And I think those, I'm going to stop there. There are other reasons why I have hope. And, um, I personally can't live without hope. So I'm like Cornel West said, I'm a prisoner of
Yes.
hope, and we're just going to keep
Absolutely.
working. We're going to keep working. Um, I think about my grandfather who said, I never met him. He died in 62. He said, I'm not working for my children. I'm not working for myself. I'll never see these changes. I'm working for my children and my grandchildren. And I never met him. And here I am as a physician, a professor. Um, and part of that is because of his and a whole bunch of people who didn't give up in the face of insurmountable odds. And that's we have to have hope, but operationalize, data informed. Um,
Yeah. Yeah, and I think what really stuck out, I mean, there's a lot of things that stuck out, but like those scripts, like I really haven't heard it taught like that about the scripts that we have. And I think that's such a, I mean, it's such a great thing that you could talk to people about the
Mhm.
scripts that they have. And so I have hope too. I have hope because really of people like you really unpacking this and getting uncomfortable, being uncomfortable, and really making people talk about this. Like I think was so significant. Like some of the programs that you did, I was like, wow, that is so powerful. You actually brought people into the room and let them have an experience to really talk about what's tough because that's the issue. I remember when I went back to work because I was on vacation when the murder of George Floyd happened. But when I went back to work, I
Mm,
just put in my little chat, I put, I'm here if
mm.
anybody wants to talk. Now, that's being one of the few, I mean, I was probably one of two of the nurse leaders. And then I'm telling you, it was like a train. People start coming and wanting to talk and wanting to, I mean, because, our allies don't necessarily know what to do
That's
when
right.
situations like that happen.
And I want to say it was really nice of you to do that. And people have to recognize that. And it's funny because I mean I serve that purpose for my university, for UC Davis, the School of Nursing, and the broader UC Davis Health. And I had served that with Michael Brown, with Philando Castile, with Eric
Right.
Gardner, and I was serving that, and somehow Mr. Floyd's death was different for me. And I was, it sounds like you weren't, but I was. I could not hear it anymore. In fact, I thought having these dialogue sessions is doing um, something negative rather than positive, because people could just be outraged, have a dialogue session, say they talked to Jann Murray-García and it was a great talk and she's great. And then we just go back
Yeah,
to the same old, same old. Now, let me say that's not invalidating what you're doing. I think that's great if you were in a space to give that. What's
exactly.
hard is when institutions require that of
Yes.
the one black person they allowed into leadership, or the two black people they have on a unit of 100 people. That's hard to ask that, especially of people you could have cared less about before.
Yeah, absolutely. Yeah, I definitely wouldn't have done it. I mean, if somebody would have asked me to do it, I probably would not have done it. I felt like it was like I think 2020 called me out. The moment
Yes,
chose me, right?
yes.
And so I had gone through this space because while I was out, I was traumatized. I was all of the deaths of, I mean, because that month we had three and it was horrible and probably way more than what we know we
Well,
had. And so I was like, okay, I felt compelled to share, and it was very
I'm happy.
uncomfortable, but I was very wounded prior to even getting to that decision point. So I think when God spoke to me and said, what you do in this moment will determine your destiny and dictate your future, I knew that that assignment was time for me to rise up and then
Yeah.
start doing my voice. But many people, and that's what I was going to ask you, Dr. Jann, many people of color are exhausted
Mm-hmm.
because we've been fighting this for so long. So, what
Mm-hmm.
would you say to those that are exhausted?
Well, and this is why I say how different our journeys have been, right, Charlene? So
Yeah,
I'm telling you, in the years leading up to that, I had done that for a fixed community, and I was finished because what the heck?
yeah,
9 minutes. We don't need to talk about anything else,
right.
right? And not to mention, it's been happening since for for centuries. But certainly, the Black Panthers were founded in Oakland because of
Yes,
the deaths of unarmed black men by police officers. So I just want to note that our trajectories were very different,
yeah,
and that I needed rest and you were up, kind of like that bird
yeah,
formation. When the
yes,
lead bird gets tired, they kind of fall back, and somebody else takes that lead position with all the resistance that comes at us. So and I was listening to Ava DuVernay's. interview with Gayle King, and they were talking about something else, but then Gayle King asked Ava DuVernay, who is a director of amazing things like Selma and 13th. Um, and and she said, "What would you say to white people who want to help?" And I was just like, I was floored because I'm like, okay, here it comes. It's Ava DuVernay. She's on it. She's going to tell us what we need to be doing as Black people. She said nothing. I wouldn't say anything. She said there are a lot of white people who've been preparing for this moment. Let them do that work so you can devote your energy to surviving the grief and the trauma of this moment.
Yes.
It was really freeing for me. Wait, we can do that? Again, that Mamy kind of thing where we hold space and we don't really have energy for ourselves, but we're going to do it for somebody else, right? That
Yes.
strong Black woman script. I'm like, I'm out. I told you, I'm out. I told my boss, who's like the chief diversity officer for the health system, I'm out. I just need a couple weeks.
It's
And
powerful.
yeah, and so you have to know yourself and know
Yes.
what, and then again, people have to recognize white privilege isn't isn't mostly about money. It's about, let me just say, I want to say this carefully because people quote me. It's also about the choice you have not to get uncomfortable and to
Yeah.
not engage in this issue and
Yes.
to look the other way. I don't have a choice. And I have two children. So I knew from very young, if you are having children, you are making a commitment to hope and make for a better world as a Black mother. Now, if you can think about having children and just soccer and college and wow, then you are privileged indeed, because I'm always thinking about my kids' safety,
Yes.
emotional and otherwise, with state actors, y'all. And so um, if you're exhausted, you need to rest and find
Yes.
your. I just read that Rosa Parks had a practice of yoga for many years.
Ah, I didn't know that.
Well, yeah, right. Find some girlfriends, find some people. There's several of the students I had the privilege to teach at the Betty Irene Moore School of Nursing at UC Davis. Are now running therapy sessions in barbershops in Sacramento for Black men.
Yes. Yes.
Saturday, just come. You don't have to but up. There's a trained psychologist there, therapist there, who's find a way to work through that. But I would say, in the spirit of not continuing to perform what is harmful to you and may make somebody else feel better, if it's your time to step back for your longevity's sake. That's we are not compelled to put ourselves in front of people every time something racial comes up. And as I'm, we've had over 350 health system administrators, faculty, staff go through this anti-racism and cultural humility training, which is 3 full days. Three, not a lecture, not a half day, 3 full days, 2 days intense, and then we meet a week later to process. Um, we are trying to build an institutional community where some of these things go without being said, and some of them have never been said and have to be said. Um,
Yeah, that's awesome.
yeah, people are. Yeah, you get in here because we're gonna. Our nation depends on folks getting past the shame, getting the truth, getting past the shame, and certainly not legislating, not knowing, because your kids might feel uncomfortable. I'm like, what's that?
Right.
What's that? Welcome to my planet.
I know. From day
Been
one.
uncomfortable all my life. My kids been uncomfortable all their lives.
Yeah,
While we were
absolutely.
teaching that other traditional U.S. history, what is the problem?
Yeah, absolutely. Well, it has been a delight, Dr. Jann. I mean, I'm
And
so full right now, so much
yeah,
wisdom. Can't wait for the book to be out.
yeah, my privilege, Charlene, and I really appreciate what you're doing and the complexity of you appreciating the complexity of this, and I'm so glad that you responded to God's call in your life to get people talking and to expose them
Yeah,
to different ways. And I hope we can love Black women in a way that the United States hasn't really loved us back always. I hope we can learn to see the contribution of Black women and other groups at risk, disadvantaged, and really learn to see how we are who we are because of what we put people through often, and
yeah,
the character of people who survived.
yeah. Well, thank you so much for being on the show. If someone wants to reach out to you, Dr. Jann, is that possible? Or where could
Sure,
they find you?
sure. I think the best way to do that is through UC Davis. I'm a professor at the Betty Irene Moore School of Nursing at UC Davis, and my email is J as in Jan, Murray Garcia, all one word, J Murray Garcia at ucdavis.edu. Happy
Okay.
to answer questions, and again, just really appreciate. Don't underestimate what you're doing, Charlene. Just really, really appreciate you
Well,
stepping up.
I'm so blessed and so honored that you came on my podcast just because I've been like wanting to hear from you forever. So I've been like, you know how you go on social media. Oh, she has a YouTube video here, there, there, and so I'm so
I haven't done that yet, but I have. We have put years extra into the book, and we
okay.
want it should be out within a year, and we want we've just put so much meat on this discussion and so
Yeah,
many historical stories behind what we're saying and so much data. I like to say we're trying to give an evidence base for the hope we're asking you to have as you do this hard work. So
oh, that's
we can,
beautiful.
we can do
That's a
this. We can do
Yeah,
this.
that's a great way to end. So you got to say that again. That was powerful.
Oh, so the book is full of a lot of research data on social psychology, on the neuroscience of implicit bias. It's full of historical illustrations like I gave today and case studies that are happening right now to really illustrate the four principles of cultural humility. So you're not going to be able to guess what you're not going to need to guess what Melanie and I meant when we said what we said in the basic 1989 article. And we're taking a lot of time um, so that people have an evidence base for the hard work we're asking them to do, that it's worth it.
That's awesome. Well, thank you so much for being on the show, and I'll see
Okay.
you soon.
Okay. Thank you.
I want to thank you for tuning in to another inspiring episode of When the Moment Chooses You. I'm your host, Coach Charlene, and it's been an absolute pleasure. Each journey we've shared today is a reminder that when the moment chooses you, the possibilities are endless.